So, hi everyone, and thank you very much for this invitation. I'm Fruzsina Iszaj, and I'm working in Hungary as part of the Innov Research Institute. I'm currently writing a review about how COVID affected us in a psychological manner and also regarding addictions. And besides, I'm providing, which is a bit different topic, but I'm providing trainings for employees to maintain their wellness and mental well-being and to enhance their productivity. So today I would like to talk about the following topics. What are the changes that are there because of the COVID-19? Of course, we talked a lot about these in these 3 days, but I would like to summarize them. Then what kind of psychological distresses are there and what changes seem to be in the field of addictions. And then we go a bit to the topic of how home office changed in this era. So COVID-19 resulted in changing social relationships, even our very close friends and family members we couldn't meet, and all this isolation was there for a long time. And actually with this COVID, I wouldn't talk in the past tense because it's there now too, and it will be there for a while. So these changes are continuous. The changes in communication are interesting that I think earlier, mostly teenagers or the younger generation were typically the ones who preferred online communication and texting mostly, not even the phone use or in person. And now we can also observe this in masses, that every kind of age group is involved in this question right now. So there are routines and lifestyle changes. These were also enhanced by the lockdowns, but there are changes which remain with us. And of course, there are the circumstantial changes like the losses of jobs, finances, because the economies are also affected. Changes in mental health services. I meant that that also, for example, patients or those who needed care couldn't reach their doctor, couldn't get the proper or the usual medication or operations. So that is also a thing that if you weren't a COVID patient, you couldn't go to the hospital, or so. This is another interesting issue. So regarding the psychological distress, I chose these 2 publications because of the sample size, basically. So the first one was made in a normal population in China, over 52,000 people, and 35% of the participants experienced some kind of psychological problems. This was in 2020. The other one was just published now. This is an international team from America and the UK, and they used an international database of COVID patients who were like ex-COVID patients. And it's a huge sample, 236,000 people were measured, and over 33% were found to have some psychiatric and neurological morbidities. Now there is, in the psychological literature, there is an agreement that female respondents are more vulnerable than male counterparts, and the younger generation show the highest psychological distress to this COVID situation. And there are a huge variety of other mental problems which might be there now and in the future that we cannot see now what is happening now. There are some publications which are which are measuring the effects of COVID, but we are on the long way ahead to do this job. So there are all kinds of problems like PTSD, depression, anxiety, and all kinds of. So switching to addictions, regarding tobacco, like smoking, it was reported that there is an increased frequency of smoking among the current smokers, and there is a bigger chance of relapse among the ex-smokers in this era. And alcohol use was reported to be increased too. Here also, when the lockdown was there, then homemade spirits were made, even from spirits or even from alcoholic liquids which are not edible. And of course, this harmful alcohol use means basically that the violence increased in the family, and it meant a lower well-being. Regarding the behavioral addictions, I would emphasize shopping addiction and internet addiction, which are highly connected. So mostly from normal shopping, we switched to online shopping. And this is a present statement because during COVID, we did this online shopping all the time, and people tend to continue doing this. So this is an interesting change. And also comorbidity was found with anxiety, impulsive behavior, and substance use. And regarding the internet addiction, porn and video games were emphasized. And of course, there will be bigger problems because of the decreased physical activity, obesity. But internet addiction was there, of course, for a while, but so humanity was on the path of the virtual world, and now COVID gave us a push to all this kind of functioning that we tend to do everything online now. Regarding the illegal substances, there is an interesting, this is a question just, or an interesting, maybe a research question, that by the one part of the illegal substances are used, or at least it's connected, they are connected to the party culture. So because of the COVID-19, people couldn't go too much out. So there was no party culture or pubs. So I don't think that this means that people use less drugs. Just it would be an interesting thing to see how did it change, or what is the change in the pattern. And this slide is also connected to the lockdown. So there was a problem with the availability of the drugs. I mean, here legal and illegal substances both. And this resulted, so in addicted people, this resulted in aggression and desperation, which had two ways. The first was self-destruction. So as we could see, as we could hear in one of the presentations, that the suicide rate is nowadays higher. The other one was, other way was experimenting. So they were taking combinations, whatever they had at home or whatever they could get, which is also very harmful, of course. And changes in the home office. So home office is present in for a long time, and all these well-being programs or employee well-being programs, especially in the US, are based on doing things in the office. So, okay, if you have a lunch break, then go to a yoga session or do this and that, but it's connected to the office. And now, of course, because of the lockdown, people had to work from home, but it seems to be a long-term trend that we might switch to this kind of mode of work. So earlier home office meant that there is an order at home, there is a place, where you can sit down, and it's a kind of chilled out work if you have self-control and you can accommodate to the deadlines a bit. Then you can create your own space at home and your own flow. So it was a very productive and calm way of working, I think. And now, because of the COVID, employers forced the employees to work from home. So it was not their choice. And it's a different kind of home office because the children were at home. So there is homeschooling and the housework and the work. The two, both of the parents are at home and they don't go anywhere. So it was a bit of confusion and chaos in most of the families' lives. And also the other side of the coin is people who are alone. For them, it's basically more problematic, this because of the isolation. So the isolation, of course, social ties provide protection against stress and tension. So if the social ties are weakened, then the executive functioning is weakened too, and the mental well-being. And there is an enhanced morbidity and mortality rate reported regarding this topic. So altogether, what changes are there? On a global level, there is a higher level of stress and tension. And I would like to draw attention to the next one, that the loss of control, because we are so much used to control. So controlling our life, our environment, we control everything, we think at least. And now COVID also teaches us that we cannot control everything. So one mutation comes, then we react. Another mutation comes, then we react again. But we don't have the control anymore. We are just accommodating, which also means the lack of freedom. So we are very much used to that we do whatever we want, basically. And so this is a very interesting, but also a kind of dark era in the history of humanity. So the result is panic and fear, especially in the beginning. Panic was characteristic, but fear is constantly there. We have fear that we will lose our loved one or our job or other things. And in the literature, anxiety and depression are now the most characteristic problems. So these are reported as an agreement between the countries, but of course we don't know enough about this on the long run. So we will see what in the next years, how people will react to all these happenings. And there are further psychological problems, like I mentioned, like PTSD and bipolar disorder. So now I'm a trainer, so that I can help people to maintain their well-being and psychological health from home, and so they can be also more productive. And as I was preparing for this presentation, I wanted to have this slide because I have more questions than answers. So we don't know a lot of things, and there is a lot of confusion, and a lot of people are working on things so that things can be better again. And with this, I thank you for your attention.